Well, hello again, everybody. Welcome into another episode of the Mind Your Business podcast, a presentation of the Boone Area Chamber of Commerce and brought to you by our friends at Appalachian Commercial Real Estate and UNC Health Appalachian here each and every week. We are back after a brief holiday hiatus. Thank you very much for allowing us to enjoy our turkey in peace and not having to podcast at the exact same time. That could get messy, and we would not want that. So we decided that coming back from the holiday, we wanted to come in with like a Thanksgiving size helping of very useful information on a very timely topic. So as we record this on the 30th of November, December 1st marks the date where Medicaid expansion finally comes to the state of North Carolina. And we want to make sure that you are aware of all of the different areas and ways that the high country will be impacted by this rollout of new services. What is available, how you gain access to that, and a little bit of the behind the scenes of how our local providers and community members are all responding to make sure that on December 1st, everything rolls out as smoothly as possible. So we have got a great group of folks. Don't worry, this is not a flashback to 2020, though we have had this box together before in a very different context. We're pleased to be joined by Chuck Mantooth and Rob Hudspeth of UNC Health Appalachian, Jennifer Green from AppHealthCare, Kat and Alice joining us from High Country Community Health. We have assembled a great team of people that are involved in all different facets of Medicaid expansion. Many of them work in this in the Medicaid world on a daily basis. We want to make sure that we explain what is new with this expansion and how those of you that aren't covered that may be eligible for this new insurance are able to take advantage of that. So Jen, as we often did back in the day, we always kind of figure out a way to start with you. Welcome back to the program and give us a sense, a little bit of the timeline of how we have gotten to where we are today.
Thanks, David. Good to be back. And we are so excited. It's been about a 10-year journey talking through the challenges and opportunities that expanding Medicaid for all of North Carolina would give. And specifically for our community, all of us are very excited about the number of people who are going to be positively impacted by getting linked to this Medicaid program that we know is not only going to open the door for lots of preventive care, but link them to other services that maybe they haven't been used to having. So we're very excited about the public health impact. We know that providing access to care is an incredible, important benchmark for us to support people's health long term. So we're super excited, ready to do the cheer all around the courtyard here. So thanks for letting us cheer about this. It's really a great thing.
Well, it's great to know that we finally gotten to this point. And Chuck, I know that we have talked many times over the course of the last several years about the different ways that insurance or the lack thereof impacts the hospital system here. So as you all are taking in this new opportunity, just how will this impact the operation of UNC Health Appalachian on a daily basis?
Yeah, thanks, David. I'll probably use just an example I heard just the other day when I was having a conversation with a physician. He said, it was a physician that works here in the hospital. He told me, he said, Chuck, we spend way too much time, trying to figure out ways to pull people out of the river rather than figuring out why they got into the river to begin with. And all that told me was we've just got a lot of work to do to intervene early on to change paths for folks from their health, where their health is concerned on a more positive path. And how do we go farther upstream? And that's something that we've been focused on, I think, all in the community, each of us on this call for years. And it's been frustrating because one of the barriers that we've seen is just health insurance. We talked earlier before we got on this call that, look, one of the things that we want folks to hear from this call is to be motivated to go ahead and sign up. Now you have this tool that's available to really kind of fix the roof before it starts raining. Go ahead and get signed up for insurance. Now we have this mechanism available so you can establish a relationship with physician. And we spent less time pulling people out of the river and more time talking about, ways to keep them out of the river as far as their health is concerned. So it's a game changer for us. And I think we've got some information coming to talk a little bit about, the magnitude and the population that this will affect. So really excited about it.
Yeah, we'll certainly get into some of those finer points here in just a moment. And I appreciate the fact that you navigated that analogy so well. I always mess it up and have people in the river in the wrong spot. So I do appreciate you tiptoed through that really well. Alice, I want to bring you into this. Back during the COVID pandemic and the height of that, we found that our community became a lot more understanding of what public health and what community health organizations could bring to the table on a daily basis, and the different populations and groups of folks within the community that you may engage with on a daily basis may have very different needs than your average provider or some other healthcare provider that others may be able to impact with. So I say all of that to set up, how do you see this impacting High Country Community Health and the work that you're able to do with your clients as now more people are able to see you for more things?
Thank you, David. We are indeed very excited about this. If you look at our patient base that we serve here at High Country Community Health, about 1/3 of the people we serve have no health insurance at all. So this is going to give them the opportunity to finally have access to that health insurance, not just for their primary care, but at the hospital. And so we are very excited about this and getting people what they need to have access to care, not like you've been saying when they're sick, but also to help with prevention and getting the good care ahead of time.
Well, I think one of the things that would be helpful to kind of set into context here on this, and I'll let any of you take this on as we, for those of you that are watching us on the YouTube version of this program, we're going to throw a few slides up at you here over the next few minutes. If you're listening on the podcast version, you'll just have to go to YouTube to see this in its entirety, but I'm sure we'll talk through some of these points. I think one of the things that will immediately jump off the page at folks is the number of folks that are impacted in our community that now have the opportunity to enroll in Medicaid because of this expansion. And I'll kind of open the floor for anybody that would like to talk about the fact that 8,000 people in a 3-county area are now going to estimatedly be able to enroll in Medicaid.
Yeah.
Go ahead, Alice.
No, it was Jennifer.
Oh, Jennifer, sorry.
No, it's okay. I was just going to say, I think we're all just fighting for the chance to cheer. We've got over 8,000 people that we know in our 3-county area, Avery, Ashe, and Watauga County, that are going to have this potential to already be eligible for Medicaid. They've just got to take the next step to determine their eligibility. One of the things that's going to be really impactful is not just their individual health, but our community's health is going to really benefit from this, because we're going to see people get that preventive care that maybe they've never been able to do prior to now.
And again, impactful that you look at nearly 50% enrollment growth based on the 17,000 and change that are currently enrolled in Medicaid. To be able to add another 8,000 to those rolls is really quite impactful. But looking at what services are covered for these patients, I think that's a common question at this point in time of number one, if you're eligible, but if you are, what gets covered? So I've got a slide up here that explains some of that. If any of you would like to kind of go down that road a little bit and explain these bullet points in more depth or more context.
I think there are several things on here that are a big deal. I mean, they all are really, but when you think about how many people need access to dental and oral health services, a lot. And it's one of the last things sometimes that people tend to is their dental care. So that's really big. And then glasses and hearing aids. It's really going to help so many people. Behavioral health, it's one of the biggest growing types of visits that we do here at High Country Community Health. So having insurance coverage or Medicaid coverage for these services is going to change lives for sure.
Yeah, David, the only thing I would add to that is that, I think that the purpose of where we want people to go is to get signed up and have a more, I guess, closer relationship with a physician to do that, or provider to do that early work to prevent something from happening, down the road. That's where we want folks to focus. There's only one on here that I see that it really is kind of in that catastrophic category. That's the hospital services. That's what we're trying to avoid. And I think it's appropriate that this slide has got, probably 8 bullet points around preventive care and relationship with the provider. and only one to talk about, the catastrophic things that we're really trying to avoid. And that's really just the mark of a healthier community. And this is our first step forward.
The only thing I would add, David, there are a lot of great services here. We've not talked about cost. Chuck mentioned, the complexity and expense associated with health insurance. We're talking about free, no copay, or even for some, low copay, like for medication, up to $4. So this is free healthcare to people through Medicaid expansion, and that's really an important point to mention.
So as we continue to kind of think about how this is implemented in our community, I'll bring up the slide that lists how patients can apply, and would offer again any of you to navigate for us just the different points that folks that may be eligible. Number one, how they find out if they are eligible, but then kind of where they take it from there.
Okay, well, we have with me our subject matter expert, Kat, and she is working on and has a list of all the things that you need to have in hand before you go online to the ePass. And also, you want to tell them a little bit about what we're going to be doing at our sites.
Yes, so we will have people dedicated to enroll patients, not just patients, anyone in the community who needs to enroll through ePass. And, this is the quickest way to get enrolled and become eligible is through ePass. But we realize that it can be a complicated application for many, and people do not have access to online or to a scanner to scan in their documents. So we are really excited to offer help to these people to guide them through the process, because it can be pretty cumbersome. And if people are able, though, they can apply online themselves or go to their local DSS office. I believe they can also call them and mail a paper application. And so some of the things that the patients will need is several forms of income, about 4 forms of income, Social Security number, North Carolina residency, and a more detailed list can be found on the North Carolina DHHS website. And, we just want to make this as easy as a process as we can.
And an important thing to remember is don't start until you have all the needed information, because if you do, then it gets shut down. You can't go back into it, and you do have to go to DSS office to finish. So having those papers there is very important.
Alice, I'm glad you mentioned that. I spoke to Tom Hughes this morning with the Watauga County DSS, and he really wanted to emphasize what you just said, that people provide complete information, accurate information, so that application doesn't get sort of kicked out, and then patients have to delay their care. That's really an important point, and I appreciate you mentioning it.
And again, on the slide listed are the public health departments that are servicing each of these counties. We remember very well that AppHealthCare deals, of course, in Watauga, Ashe, Allegheny as well. The Toe River Health Department handles Avery County. And then you've got some great partners in High Country Community Health and the Community Care Clinic, along with UNC Health Appalachian, that are great contact points for the website. That ePass website, epass.nc.gov. And we'll have that in the show notes as well for those that want to check that website out, see a little bit more about the information, and then again make sure that accuracy is at the root of all of this. And one other thing that I'd like to make sure that we bring up with you, and Rob, you may be the best person to start this with. I think there is a lot to be said for and again, this is a refrain from 2 years ago, the value of the information you get and where you get it from. There are great providers that, again, are working in this particular endeavor every day that can make sure that you get accurate information about what to expect, what to provide, and ultimately what services will be able to be there for you. But I would also imagine that there's a lot of misinformation out there as well, or just confusing information about who may be qualifying or what those parameters are. What would you offer as a suggestion for somebody that's just confused and may want to say, hey, I need somebody to help me figure this out? Because I got a feeling that there are going to be more than a few of those people raising their hands.
Well, I'll say we do a lot of Medicaid enrollment in our hospitals. We have boots on the ground care management teams that provide assistance with that, whether that's with Medicaid assistance or even if they don't qualify for Medicaid, with our financial assistance policy. But we failed if we get them at the hospital level. So we've got a number of community partners here that we're working with. There's a group of people that are putting a program together. You've seen some. Well, there's the slide. A lot of them. I think first point of contact is going to be your local DSS, county DSS agencies. Certainly they have those, but we will augment those services through different outlets. You're going to see community events, information sessions, enrollment programs where people are face-to-face with you that can help you. We just want to make sure people know that this opportunity does exist and not to be fearful because it hasn't worked for them in the past. And again, healthcare insurance in and of itself is complex. People are fearful of cost. We're going to have people face to face for you to be able to access these services. Make sure that we direct you in the right way, and that we, even DHHS has a number of resources that help guide people that want to assist others with enrollment. So there's a detailed step-by-step. There are videos about ePass and how you go through that, what information they need, just a bevy of resources. But it can be daunting and confusing. And so we feel like having not just websites and phone numbers, but people actually that are willing to meet with you face to face. And so how we execute that, I think, will determine how successful we're going to be.
Very well said there, and I'll ask a couple of questions, and I'll leave this for anybody to answer because I've got two that are on my mind immediately that may come up in the immediate. With as many seasonal residents as we have in our community, I'm sure that there will be some questions about eligibility related to that. I would assume that this is your primary residence is North Carolina kind of conversation, but is that as cut and dry as Medicaid expansion is in this particular setting?
So, David, I think you have a slide that shows the income levels that will qualify. I think that might be good for people to see. But yeah, you have to sign up for North Carolina Medicaid. You must be a North Carolina citizen.
Must be a resident. Yeah.
Must be a resident.
Probably like whatever's on their driver's license. They'll go off of probably that address.
And again, you can
138% of the poverty level. And so you can see the numbers, and it's, yeah.
Sorry, I was just going to say, I think one of the things that's important is there's a lot of community locations here that are going to help you. So if you think you may qualify, but you're not sure, better to ask. Better to ask because Kat, you walked through it so well at High Country Community Health. You also have other services, right, to be able to link people to healthcare.gov and walk them through during the same process. Same goes for AppHealthCare. We will have someone available to help folks walk through the process, whether that's Medicaid or the healthcare marketplace. And so I think if these numbers are confusing, don't let that intimidate you. Reach out because, as Rob said, we have people, actual human beings that will walk you through the process, which is, and we don't want anyone to have a wrong door here in this community. We want everyone who is eligible to get enrolled.
Well, and that kind of leads into my next question. And I believe we, in the conversation that we had prior to recording here, I believe I heard one of you address this. So I'll ask it in this case. Certainly this enrollment period begins December 1st. This is kind of a flip the switch on type day here in the state of North Carolina. So we're excited about that. But assuming that there may be somebody that runs into a more emergency situation, maybe in the process of gathering all the paperwork, but needs to get care, is there a way that those people should treat this process? Obviously, emergencies are emergencies, but I would imagine you don't want people delaying treatment to make sure that they get paperwork in just to satisfy that requirement. Is that correct?
That's right. You want to go to a location that can see you if it's a non-emergency issue. The best place is to go to a local healthcare provider. And we do have providers in the community, like High Country Community Health, that will see you regardless of your insurance status or your ability to pay. And I think same goes for AppHealthCare. So we don't want you to use as I'm not going to do so well with the analogies, Chuck, as you did earlier, but we want you to prepare for what could be illness in the future by making sure you get linked as soon as possible with primary medical home. That's how you're going to get the best care, because your provider can help direct you to what you need and what's best for you. So please don't delay in that. And then all of us, no matter where you're accessing healthcare in this community, we're going to link you to whatever services like Medicaid is available.
Well, and I would also imagine too that over the course of that type of rollout, and we've seen this in a number of circumstances over the course of time, patience may be a little bit of a virtue to consider as people are again getting documents processed and things like that. I would imagine that there may be some opportunity to just practice and apply some grace to a situation that again is getting the switch flipped on December 1st.
I think so, and I think all of us would want to give a big kudos to our DSS partners, because they are also lifting a big load here. I know the state is doing a lot, but our local DSS partners are great resources as well, and they're working hard. We do all need to be patient, because this is a big deal. It's going to take a little bit of time, but we're going to work through it together, like we have other challenges, and we're going to see a great opportunity come from this. A lot of people getting linked to healthcare.
I also want to give a shout out to our state legislators. This is, I think Jen said, 10 years in the making. And so the way it's being paid for, hospitals actually pay for this program. And so we're excited about being able to do that. We're the 41st state, and we get to, hospitals also get to, there are $8 billion associated with this that will to pay for this care. So we get $8 billion of federal money to make this happen. So we're excited. We've been missing out on those federal dollars for years now, and this is a great opportunity. So thanks to our legislators for making it happen.
Well, Rob, while I've got you on the screen here, we told you that you were going to be the traffic cop, and if there was anything that we left out of this very complex conversation, you get to be the one to make sure that that we get all of those bases covered. So like you're Tony Reale's guy here. What did we miss?
Well, I think our group covered it really well. I mean, these are people that, particularly Jen and Alice, that see it every day front line, and I'm grateful to them. I can't help but think, our emergency rooms are always crowded, and part of that's because these folks rely on that care, as their entry into healthcare. And so we believe this will impact other people as well that are, not Medicaid expansion enrollees, but everyone, because again, we do enroll so many people through the emergency department. That's their point of entry. We've got to change that, and these folks have done a good job explaining that. But I think other people in the community will see the impact of that in our emergency departments, right away. So we're hopeful and excited about that as well.
Well, excellent. Well, I can't tell you how impactful this conversation has been. I'm sure that this will be something that people will go back and review again. We encourage you to do so. And again, we'll put some links in our show notes for you. If you get this via the Chamber Report email, there'll be some documentation in there as well that you can go back and review. And I'd encourage you to reach out to your healthcare provider if you've got any questions. Certainly, these folks here on this particular conversation today are well versed in this, but they have done a great job training their staffs to make sure that we can all handle what's to come as part of this very important rollout here in the state of North Carolina. So, friends, one of these days we'll get to do this in person instead of on a computed platform of choice. But really appreciate the partnership, all of you working together and for doing something that's going to help our community in endless ways as we move forward. So nothing but the best to you. Happy holidays, and we look forward to talking to you again soon.
David, thank you for making this happen.
Yeah.
Yes.
Thank you, David.
David.